morning. My intent is to present, I guess in academic terms, what would be called a case study, but I kind of like Bob's approach of just telling you that I'm going to tell you a story. And this is in regard to the development of a place-based strategy for improving the delivery of workforce development services to low-income participants, to prepare them specifically for careers in the healthcare industry. So that's my intent. My hope is that this will be helpful to you both as an illustration of good community development practice and a useful process for thinking about and applying for federal grants. In the area where I work on the near northwest side of the city, we don't have the problem Bob described of lacking a platform. What we have, if you can imagine the platform during rush hour in a subway station, is when the funding door of opportunity opens on the train, there are 50 people muscling their way into the door to see who can get a seat on the train. So that's what we have to deal with when we start to think about how we're going to do place-based development. So it's the good news, bad news scenario. The good news is we have resources. The bad news is how do we make those really work for the people that we say we're trying to serve? So this is a story about what we came to call the Allied Healthcare Career Network. In biblical terms, it's about the walls of Jericho coming down, and maybe in bureaucratic terms, it's about silo reduction. So who is we when I say we came to form this network? Some of the names of the players I mentioned may be familiar to you, they may not be, but what is more important to the story is the fact that all the members of the network are well-established organizations in Chicago, and all have been operating programs aimed at career preparation for at least a few years. And also that all serve communities that are predominantly Latino or mixed Latino and African American. And probably none of the members are more than 5 miles from another member. Probably most of them less than 5 miles in that radius. So there is a place-based aspect, very much so, to this strategy that I'll talk about. It's rooted in individual neighborhoods, but it's about going beyond individual neighborhoods and making some linkages. The players include Association House of Chicago, Chicago Commons, and Erie Neighborhood House, which is where I'm from. These three organizations have all been in existence for more than 100 years and come out of what I call the settlement house tradition. Casa Central, another of our members, is more than 50 years old, more of a post-World War II version of the social settlement. And the National Institute for Latino Education, formerly the Spanish Coalition for Jobs, is also a longtime provider of employment services here in Chicago. And then we add to that the Humboldt Park Vocational and Educational Center of Wright College, one of the city colleges of Chicago. So 5 CBOs, a community college, and then last of all, we added a relatively new group. It's called the Greater Humboldt Park Community of Wellness, which is a coalition of healthcare employers in the neighborhood. So why did we come together? Why even think about collaborating? Well, the catalyst for all this was an RFP from Health and Human Services calling for proposals that addressed the objective of preparing low-income residents, including a significant number of public aid recipients in the mix, for jobs in the healthcare industry. As we at Erie considered this grant, we knew that we could really not apply for this on our own. First of all, this was actually a very generous grant. You could ask for $1 to $5 million per year for 5 years, and praise God, there was no matching requirement. You know, so often with these federal grants, in order to get $250,000, you have to have $250,000 to match. And so you sit there and scratch your head and say, well, how do we do that? And as was mentioned earlier, often the biggest amount of dollars that you have that you could use as a match are also federal dollars, therefore you cannot use them as a match. So I read this 2 or 3 times to make absolutely sure I was understanding there was no match required. So this was very exciting. But again, at that level of dollars, it was clear that we needed to get more people around the table to produce the kind of results that we should have if taxpayers are putting up $1 to $5 million a year. Second, we also felt that, of course, for that kind of money that the outputs and outcomes, as I said, needed to be more substantial than anything Erie House could produce on its own. And then thirdly, that collaboration was a highly recommended strategy for a successful proposal. The feds almost always recommend this, but often do not put enough money on the table to actually pay for it. Collaboration is wonderful and it's expensive. Again, expensive is a relative term, and personally I think it's good bang for the buck, but it's not cheap. So collaboration in my mind, and I've been doing this for many years at Loyola for a while and now more recently again back in the community, it's kind of like what Benjamin Franklin said about democracy. It's the worst form of government, except it's better than anything else we've found. And to me, collaboration is probably the best form of community practice, but it is, in non-academic terms, a pain in the ass to do. We at Erie then, our Director of Adult Programs and myself as Senior Director of Programs, started to think about who we already worked with, who was involved in some aspect of workforce development for healthcare careers. And we then issued an invitation to these organizations and said, if you haven't heard about this RFP, here's what we know. Are you interested in sitting down together and talking about how we might jointly submit a proposal? What came out of this, as I said, is the Allied Healthcare Network. And let me just quickly go over the rationale then of what we came up with. While most of us knew and respected each other's work, the prospect of securing some significant new funding was certainly a serious motivator to bring us together. They say money talks, and I would say $5 million shouts. And so once we began our discussion, we looked at what each organization could contribute to the collaborative effort and what each organization, of course, might gain in the way of expanded services. And 2 things became clear. One, we should have connected the dots and been working more closely together all along. And secondly, the formation of the network we began to envision would clearly benefit the communities that we serve. And that, of course, should be the bottom line. So the vision that emerged was the creation of multiple entry points for a variety of skill levels with some facilitated access to appropriate entry-level programs, as well as pathways to more advanced levels of opportunity for earning better and better wages. So on the one hand, I've always been irritated by people saying any job is a good job. That, none of us really believe that, right? But on the other hand, some people have to start somewhere. So the idea of taking someone who has a 3rd grade level of skill and in a short period of time bringing them to a job that's going to pay them $20 an hour, it ain't going to happen. So we have to create stages, but I think what we found with our participants is we need to give them a picture that motivates them to see that, yes, this will be a longer-term activity, but you can see the steps along the way. Because when you can't see them, it's hard to be motivated to invest in a long-term process, which for some of these folks it's going to be. So we also decided that while nursing, both registered nurse, LPNs, et cetera, continue to be in demand and at the top of the career ladder, certainly important goals, that for our heavily barriered population, we needed to have some shorter-term goals and outcomes. And thus our focus on what have come to be known sort of the allied healthcare jobs. So this begins at the lower level with certified nurse assistant and moves along kind of a spectrum to certified medical assistant, phlebotomist, medical billing and coding, x-ray technicians.